Let's talk about depression because it affects about 10% of the population. Some people think depression is just sadness, and others believe it only means having suicidal thoughts. But depression can look very different from person to person. Common symptoms can include persistent sadness, emptiness, and emotional numbness, loss of motivation, and lack of joy, difficulty concentrating, and making decisions. Depression can happen for many reasons, such as a burnout, grief, loneliness, trauma, stress, hormonal changes, and genetics. Treatment often includes therapy, lifestyle support, and psychotropic drugs, and sometimes treatments like electroconvulsive therapy is also used. But recovery rates are actually much more positive than many people think. 65% recover fully, 25% live stable lives, often with work and minimal medication, and 10% continue to struggle and may need long-term support. In this video, I'll show you some images from the Danish treatment guidelines for depression, and I think they're probably amongst the best in the world. The red text is a Google Translate of the original Danish version. The important thing about this guideline is that a psychiatrist are expected to begin with the first-line treatment that has the least side effects. That gives patients stronger protection and better rights within the healthcare system. The final guideline I want to share is about reducing medication of full withdrawal. Treatment should always be reassessed after the acute state, and treatment with medication for more than 2 years should be assessed annually by a physician. So withdrawal from psychotropic medication should always happen under medical supervision because withdrawal symptoms can be very difficult and they may resemble symptoms of depression. These guidelines can give some clarity and some hope because recovery and improvement are possible and support matters.